Hey, everybody, welcome to another edition of Dr. Rick. I'm Mike Claiborne. Dr. Rick Lehman is with us, and our special guest is the Hall of Famer, Ozzie Smith. And we're going to have some fun talking about a number of different things tonight with regard to Ozzie's career, injuries, rehab, things that you all want to know, not only for yourself, but certainly for your loved ones, as we try and give you as much information as we can. And of course, everything is brought to you by our good friends from Ermi. Free to move again, free to live again is what we like to say about them. So first of all, Ozzie, thanks for joining us. It's a real pleasure to have you on our show.
Thank you. Thank you guys for having me. How you doing, Dr. Lehman?
I'm good, Ozzie. How are you?
I'm good, man. I'm good. Thank God.
Well, Rick, why don't you start it off, because we got a lot of things we want to cover with the Wizard.
No, well, first of all, thank you very much for your time and participating in this. And really, it's an honor to have a Hall of Famer, baseball Hall of Famer, probably one of the greatest shortstops ever on the podcast. So I think starting it off, people want to really know about injuries, your injuries, obviously your rotator cuff, and kind of how you got past it. How did you have the career you had with the shoulder you had? And we'll start with the shoulder, and we'll talk about other injuries along your career. But that's probably the most amazing of guys like myself, trainers, sports docs, etc.
Yeah. Well, Rick, that was probably the most serious injury that I had. Of course, as an athlete, you always have a twisted ankle, broken toe, stumping your toe in the middle of the night and things like that. But the rotator cuff, I really believe that my greatest accomplishment in the game was being able to play from 1985 to 1996 when I retired with a torn rotator cuff. Now, I didn't get the rotator cuff fixed until after I retired, when I started playing golf, because it started affecting my golf game. Already squared away and stuff, but the torn rotator cuff actually started. I dove back into first base just before the All-Star break in 1985, and it started some impingement. And from that point, I eventually tore the rotator. And for anybody that's ever had that injury, it's probably one of the most painful and one of the toughest injuries in the world, because the rotator does so many things. It helps you open the car door. It helps you turn the radio dial. And you don't realize that until, it's torn. And so that, to me, was my greatest accomplishment, being able to do those things and continue to play at a high level from 1985 to 1996 with the torn rotator cuff. Of course, I couldn't do anything over my head. I could do everything from down below the 90-degree angle, and it was just one of those things that I think the body adapts to. And lucky for me, I was athletic enough to be able to make the changes that I needed to make. I learned how to use my body more, how to round the ball, and the other instincts took over.
And did you do anything specific, any kind of training, any type of strengthening? Tell the listeners kind of what your regimen was from spring training on.
Well, learning how to use the surgical tubing, for one thing, learning to do the external rotation, the sword in, the sword out. All of those little small exercises became a part of my everyday routine to try and protect the rotator cuff, try to build those muscles up around it to protect it and stuff. So it became a way of life for me, and it was something that I learned that I continue to use today. So for those out there, all your listeners out there who have ever had to deal with a torn rotator cuff, it's not one of the easiest things to deal with, but I was fortunate enough, and I guess athletic enough, to be able to work around it. And as I said, that was the greatest accomplishment.
That's awesome. Now, in terms of your playing career, what other injuries did you come across? Anything else that you had to rehab? Anything else that was a problem? Other than, as you said, kind of the day-to-day nagging things, anything major that you would say, hey, this might have been an impediment, but I was able to get past it?
No, the rest of it was what were the things that happen naturally every day. I can remember getting up in the middle of the night and breaking my toe. At the top of that didn't stop me from playing. I hear today a guy broke his fingernail and he can't play tonight. So, I guess they don't make them like they used to. But remember tearing or cutting out the top of my shoe so that there wouldn't be pressure on my foot there, and I continued to play with a broken toe.
Ozzie, I wanted to ask you about conditioning and training as a player, then in what you do now, because you maintained pretty good conditioning and stayed in great shape since your career was over. I can't say that for everybody that we run across in professional sports, but what have you been able to do, and what are some of the things you tried to live by?
Well, first of all, let me say thank you to you, Mike, because you introduced me to a guy back in 1987 by the name of Mackie Shillstone, who took Michael Spinks from a light heavy to a heavyweight. And he worked out of New Orleans. And my introduction with him is really what allowed me to play a few more extra years. I went to Mackie and told Mackie that I wanted to put on some more pounds, but I didn't want to lose any flexibility. And we were able to do that. And Mackie remains my friend to today. And the things that we worked on when I was going down there to see him are things that I use today. It was kind of a lifestyle, and I use that today to try and keep myself in good shape. I do have a trainer that comes over to the house 3 days a week. So it's a lifestyle for me.
Yeah, and that's something that you mentioned, a lifestyle. I think some people look at training and working out as an arduous task, but once you get used to it, and obviously, Dr. Rick, you know better than anyone, once you see the results, you accept it, and it seems like it's just, as you mentioned, it's a lifestyle. So it's not something you're pushing back on a regular basis compared to some people who are just like, oh, I got to go to the gym. I got to, it's one of those things. Once you see the results, you sign up for the next day, no questions asked.
No, that's it. I mean, you have to see results, and I think the quicker you can see results, the more you get into it. For me, the hardest part is getting started. Once I get started, it's things. So it becomes a mind over matter, and if you don't mind, then it should. So getting started in the morning, and once I do that, it's clear sailing, and I've gotten to a point now to where when I don't do it, I feel it, and I feel guilty.
Right. I think that's the key right there. Is it's a positive addiction, and when you don't work out, you're always thinking, "Why didn't I work out? I should have worked out," and it bothers you. And once you get to that point, it's easy. And Claibs, you have the lifestyle. You lost a ton of weight. You're getting into shape. You look great. You didn't do that just by luck. And there's no gimmicks. As you said, Oz, you got to do it every day. It's got to be a lifestyle. I knew Mackie a little bit back in the day, and he truly was ahead of his time as you were going down there and working out. And that was pre when athletes really didn't do that. That wasn't, now it's kind of common. We go to IMG, we go to these different places, we send our athletes to get ready for the combine or spring training. But back in the day, that was kind of a sort of a state-of-the-art thing. So tell us about that a little bit. You went down to New Orleans, you worked out with Mackie. Was he specifically working on your shoulder, just your general conditioning? Kind of what happened down there?
We did it all. It wasn't just weightlifting, it was nutrition. It was learning how to keep your body in good shape, and how to eat well. And it's things that I was able to take with me throughout the rest of my life, the things that I use today. So we combined nutrition and weight training. And, I had gotten up to almost 190 pounds at one point, that they were calling me a bull. I look like a bulldog. But one of the things that I learned through the process was that was a little bit more weight than my frame could carry. So I had to kind of back off a little bit, so that I could maintain my mobility and flexibility. And, with Mackie by my side, we were able to do that. And, I got a lot stronger as the season went on. I was able to put two halves together, and that's what I was trying to accomplish.
Wow, that's amazing. And it sounds like you still believe and work through those principles. You have a trainer. And I think for people out there listening, I think a couple things. One, if today were back in 1985, we'd probably say, let's go over to Ozzie's Regeneration Center, maybe get a PRP injection. But there wasn't any PRP back then, so you had to do it on your own. And, there are things now that you guys are doing in your center that I think augment that whole process of training, self-healing, trying to avoid surgery, etc.
Yes, definitely. I was one of those guys that are always looking for a different way to do it, and all in trying to stay healthy, in the name of trying to stay healthy. So I met these guys probably about 6, 7 years ago, and I went down to Paducah, Kentucky, and I was still having a little stiffness in my shoulder, and that's when they introduced me to PRP and stem cell. And there were so many people going from here in St. Louis down to Paducah that they asked me if they opened a clinic here, would I be willing to partner with them, and I did. And now we have 6 or 7 clinics, and things are going well. We're giving people their lives back by not having to go under the knife, and it's just been a great experience for me. And technology and stuff continues to grow, and it's just getting better and better as the days go on.
I wanted to ask you about the Regeneration Center, the Ozzie Smith IMAC Regeneration Center. There's one in St. Louis, as you mentioned, and you have a few more spread around the area. And this is something I want to ask you as well, Rick. When it comes to regeneration, this is kind of a new territory for a lot of people. So from a rehab standpoint, Rick, what do you see in regeneration now compared to when Ozzie was playing, and how much of a game changer has it been, especially when you have companies like Ermi, where they get involved in the rehab and making sure the range of motion continues? How much have we narrowed that gap from when Ozzie was playing and when he had his situation to compare to where we are now?
Well, it's interesting. I think Ozzie kind of was on the forefront. He rehabbed rotator cuff care, which is amazing, especially as a shortstop. I think today he probably would have had a PRP stem cell combination. We'd send him over to the Ozzie Smith Center. They would inject him, or maybe BMAC, bone marrow aspirate. And I think that combination changes the environment of the shoulder and allows the inflammation to resolve and enhances the healing, or decreases the inflammatory response. So strengthening enhances the healing. So it's a game changer for my practice, which, high-level athletes. And I think the pro kids, we do it on a routine basis. If someone gets hurt in the Olympic trials, we'll fly them down and we'll inject them. And I just think that that's something that's just going to continue, as Ozzie said, to progress. I mean, that's where all the improvements, that's where all the research is going. And I would say that Ozzie's Regeneration Center will be on the forefront. They'll be looking at different types of stem cells, different cultures of stem cells, et cetera. And that is where the growth is going to be. We're not going to get that much better at fixing a rotator cuff.
Right. Well, let's talk about the platelet-rich plasma, which is called PRP, and it's the healing property in the body. And so when you hear them talk about, and I know it confuses a lot of people when they talk about spinning the blood. Well, basically what you do is you draw someone's blood, you take it and you put it down, and from that comes a serum. And those are the platelets that you take and you put that in the injured area, and that promotes the healing. That's the PRP. And then, of course, you have stem cell, which is more like your DNA. We try and get that, doc, you have to come up with the name. I'm not a doctor, so the names, you get it from around
so we're going to try to harvest the stem cells, and we're going to try to harvest, and you're right, it's the DNA, it's pluripotential cells, immature cells. And when we inject them, they can become anything that the environment will allow. So they can become cartilage cells if you have arthritis. They can become collagen cells if you have a torn rotator cuff. And those pluripotential cells, then they're like little babies, and they grow up to be similar to the environment and again, enhance the healing. And that combination, and just like you said, Ozzie, what you're putting in there, what makes your skin heal, what makes a fracture heal, those are called cytokines. And what you're doing is you're getting a high concentration of those in the platelets, and you're putting them, just like you said, in the bad area to enhance the healing.
Yes.
I have nothing to add to that. I just took another biology class here all of a sudden. Hey, when it comes to rehab, and the Regeneration Center is involved in that as well, Ozzie, the rehab equipment that they have now, certainly provided by Ermi, which is in a lot of rehab centers. Range of motion is something we hear so much about. What were some of the things you had to do in order to continue to have range of motion as you were trying to make sure you could stay on the field?
Well, stretching is always important. Even when you're healthy, stretching those muscles and making sure that they have elasticity. So that becomes a very important part of strengthening a muscle as well, being able to do that. And that's one of the reasons that I was using the surgical tubing. You probably saw me running around. I always
Mm-hmm.
with me when I was sitting around just doing nothing. I was working on my internal and external rotation and all the little muscles, doing the things that strengthen the little muscles around that rotator cuff that was going to protect it as much as possible.
So I think that's amazing, and I think that's a lesson to be learned for all our young athletes out there, and that's kind of the routine, day-to-day things you need to do if you want to play at that level. And you're 100% right. That's strengthening your rotator cuff, doing your surgical tubing, your stretching, making sure that you're warmed up before you get on the field, and that has to be that's like brushing your teeth. You got to do that day after day after day, and if you can fill your time, your dead time. I have patients and they tell me they're standing in line somewhere and they're doing toe raises because they just had ACL surgery. And, if you can fill your dead time doing something productive like that, that's amazing. So all the people out there with rotator cuff pathology, partial tears, impingement, think of that. And if you can do those people say, oh, I don't have time to do the exercises. Well, you got plenty of dead time during the day. Do your exercises.
Yeah, well, let me say this here. When you're young, talk about stretching. You go out there and you don't have to, you don't have to stretch, get to it. But as I've aged, I realize at how important that is. And you can't stress that enough to young people. Now, even professional athletes, some guys just come right out and, they just throw the heart as hard as they can right off the bat. Well, that'll catch up with you eventually if you don't go out and start loosening yourself up and getting that blood flowing to certain areas.
Hey, Ozzie, for you, baseball is over as far as you playing. What other activities do you get yourself involved in? I know you enjoy playing golf. And what sort of challenges do you deal with physically from that standpoint? Because as we get older, some things don't work as well as they used to. So what are some of the other activities you like to participate
Well,
in?
I love golf, and I think all of us gravitate to golf because it fills that competitive void in your life, and probably it's probably more of battling yourself than it is the people you're playing against. It's that challenge of being able to go out and get yourself in a position where you're going to be respectable each and every time out. It's a game that you'll never um, you'll
Master?
master it. So you're trying to get yourself to a point to where you're just able to say that, I'm consistent and I know I'm going to shoot between, say, 75 and 80. And that's what you got to live with, man. I don't know if it's better at that once you reach the 80. But it's about competing and competing with oneself that I think that drives you more than anything else. And I just got back from Greenville, South Carolina, where I had a chance to play in the BMW over there, and I usually go out to Tahoe. I didn't make it this year for some reason. I don't know who I got to talk to about that, but I did that for a year. I get to play in some wonderful tournaments and stuff, and I have a group that I've been able to travel with. They're out of Pittsburgh, that I've been able to travel to Scotland and Ireland and stuff. So, I've had a chance to do some wonderful things in my life, and I'm just continuing to live, man, trying to.
Hey, who are some of the best athletes that you played with and played against in baseball, and some of the best golfers you play with who maybe were former athletes in another sport but found to be pretty good golfers out there?
Well, as far as athletes go, Dave Winfield was probably one of the best all-around athletes that I had a chance to play with. When I broke it in '78, he was one of the best, and then I had a chance to watch Andre Dawson perform in Montreal, and he was dangerous. As far as golf goes, um, John Smoltz probably is the best golfer I've had a chance to play with. Although the left-hander that used to play here,
Mark Mulder.
Mark Mulder is a good golfer as well. So baseball players have and hockey players have been the guys who have had the most success with golf since they retired and stuff. And I get to see Grant Fuhr in a lot of tournaments, and he can hit it a mile, and he's a pretty good player. Of course, Vince Coleman. 2 weeks ago, I was with Gary Templeton and Vince and Marcus Allen and everybody. So, I still get a chance to see the guys, and we battle. We still do battle.
And a lot of trash talking still going on, I bet.
And the lies have gotten bigger. That's all.
Hey, I want to ask both you guys, as people watch and listen to this, especially parents and youngsters as well, what advice do you give them about how they are able to maintain a physical presence, also being able to have good practice and habits, not just going out and playing, but certainly training and making sure, as you touched on something earlier, Ozzie, about stretching. Stretching doesn't apply to people over the age of 50 years old. It probably isn't a bad idea to start it at an earlier stage. So Rick and Ozzie, give us a little advice on some things parents and athletes can take away from today.
Well, I'll do it real quick here. The one thing that I always try and leave with young people is that I know that in life, I'm only going to get out of it what I put in. If I don't put anything in, then I shouldn't expect anything in return, and that's life. And so if you love your sport or whatever it is you choose to do in your life, there has to be some blood, some sweat, and some tears. And no success comes without the blood, the sweat, and the tears.
Rick, what about you?
I think that's a great message. And I think guys like Ozzie really, Roger Federer, there's guys out there, they just live their lifestyle right. They knew what they had to do. Just like Ozzie said, they put the time in, they did all the right things, and they got their just rewards. And I think for parents, I think your kids really need to have a commitment to their sport. And it means not being on the internet all night. It means not going out all night. It means not being on Snapchat. And really,
although Cameo is a good idea,
Cameo is great.
Make money there. Rick is right. I used to tell my kid, I can't want it more than you want it. And a parent shouldn't be sitting around saying to his kid, shouldn't you be out practicing? If a kid loves something, then he's going to do it, and he's going to do it without being told to do it. And if he finds that thing early enough in life, he'll never work a day in his life.
That's right.
All right. Well, fellas, this has been a blast, and just having a chance to hear you guys go back and forth about something that we don't pay attention to until we get hurt. But for you guys to talk a lot about some of the things you've experienced, it's been a blast. And we want to thank our folks from Ermi, because anytime you go rehab somewhere and you're trying to expand range of motion, you're probably using their equipment. And of course, check out Ozzie Smith Center. Go online, check them out. It's called OzzieSmithCenter.com. And just check them out. If you need to talk to somebody about your personal situation or maybe a family member and you want them to have more fun in their life or your life, you ought to go to OzzieSmithCenter.com, check them out, and I'm sure they can get you on the right path like they've done many of my friends over the course of time, and they can do the same for you. Gentlemen, thank you so much for your time. Rick, it's always good chatting with you and the Hall of Famer, Ozzie Smith. We certainly appreciate you taking the time today, sir, and visiting with us and sharing your knowledge.
All right, man. Back to my cameos.
There you go. He's Rick Lehman. He's Ozzie Smith. I'm Mike Claiborne. We thank you for watching here on ClaibsOnline.com.
Scar tissue left behind by an injury or surgery can reduce normal joint function and limit range of motion. 15% of patients struggle with chronic pain and long-term functional disability because of scar tissue. For these patients, the ability to work is limited. Treatment is more costly. Repeat surgery is risky, but there is a better, clinically proven solution. Ermi is the standard of care for non-operative treatment of patients with severe motion loss. Our service rescues patients who have not responded to standard motion recovery therapy. We have supported the treatment and recovery of more than 100,000 patients with a 90% success rate and 0 complications. With Ermi, patients are free to move again, free to live again. Ermi is not a brace, and it's not just a product. We're a team of doctors, engineers, and professionals dedicated to the science of range of motion. Our specialized equipment is part of a step therapy program that works in partnership with the patient's clinical team. For more information, please visit our website.